NCLEX RN Test Bank for 2026 Part 2. Question 1. The nurse is preparing a client for surgery. Which lab finding should be reported to the physician? Potassium 2.5 mg/L, hemoglobin 14.5 T/dL, blood glucose 75 mg/dL, white cell count 8, via mm3. Here are the options. Option A, potassium 2.5 mg/L. The correct answer is option A, potassium 2.5 mg/L. Correct answer, potassium 2.5 mg/L. Question 2. A patient refuses to take his dose of oral medication. The nurse tells the patient that if he does not take the medication that she will administer it by injection. The nurse's comments can result in a charge of malpractice, assault, negligence, battery. Here are the options. Option A, assault. The correct answer is option A, assault. Correct answer, assault. Question 3. The primary cause of anemia in a client with chronic renal failure is poor iron absorption, destruction of red blood cells, lack of intrinsic factor, insufficient erythropoietin. Here are the options. Option A, insufficient erythropoietin. The correct answer is option A, insufficient erythropoietin. Correct answer, insufficient erythropoietin. Question 4. A client with tuberculosis who has been on combined therapy with rifampin and INH isoniazid asks the nurse how long he will have to take medication. The nurse should tell the client that medication is rarely needed after 2 weeks. He will need to take medication the rest of his life. The course of combined therapy is usually 6 months. Here are the options. Option A, the course of combined therapy is usually 6 months. The correct answer is option A. The course of combined therapy is usually 6 months. Correct answer, the course of combined therapy is usually 6 months. Question 5. A client with severe anemia is to receive a unit of packed red blood cells. In the event of a transfusion reaction, the first action by the nurse should be to notify the physician and the nursing supervisor, stop the transfusion and maintain an Roman 4 of normal saline, call the lab for verification of type and cross-match, prepare an injection of Benadryl diphenhydramine. Here are the options. Option A, stop the transfusion and maintain an Roman 4 of normal saline. The correct answer is option A, stop the transfusion and maintain an Roman 4 of normal saline. Correct answer, stop the transfusion and maintain an Roman 4 of normal saline. Question 6. The nurse is caring for the client receiving amphotericin B. Which of the following indicates that the client has experienced toxicity to this drug? Changes in vision, nausea, urinary frequency, changes in skin color. Here are the options. Option A, changes in skin color, liver toxicity in the client taking Abelset amphotericin B. The correct answer is option A, changes in skin color, liver toxicity in the client taking Abelset amphotericin B. Correct answer, changes in skin color, liver toxicity in the client taking Abelset amphotericin B. Question 7. Nimodipine nimetop is ordered for the client with a ruptured cerebral aneurysm. What does the nurse recognize as a desired effect of this drug? Prevent the influx of calcium into cells. Restore a normal blood pressure reading. Prevent the inflammatory process. Dissolve the clot that has formed. Here are the options. Option A. Prevent the influx of calcium into cells. Calcium channel blocker and is used to prevent calcium influx. The correct answer is option A. Prevent the influx of calcium into cells. Calcium channel blocker and is used to prevent calcium influx. Correct answer. Prevent the influx of calcium into cells. Calcium channel blocker and is used to prevent calcium influx. Question 8. A client hospitalized with AIDS tells the nurse that he has been exposed to measles. The nurse should contact the physician regarding an order for an antibiotic, immune globulin, and antiviral airborne isolation. Here are the options. Option A. Immune globulin. The correct answer is option A. Immune globulin. Correct answer, immune globulin. Question 9. A burn client is in the acute phase of burn care. The nurse assesses jugular vein distension, edema, urine output of 20 ml in 2 hours, and crackles on auscultation. Which order would the nurse anticipate from the physician? Furosemide Lasix 40 mg Roman 4 push irrigate the Foley catheter, increase the Roman 4 fluids to 200 ml/hr, place the client in Trendelenburg position. Here are the options. Option A. Furosemide Lasix 40 mg Roman 4 push suspect CHF and anticipate an order for a diuretic to remove excess fluid. The correct answer is option A. Furosemide Lasix 40 mg Roman 4 push suspect CHF and anticipate an order for a diuretic to remove excess fluid. Correct answer. Furosemide Lasix 40 mg Roman 4 push suspect CHF and anticipate an order for a diuretic to remove excess fluid. Question 10. The nurse is caring for a client with a radium implant for the treatment of cervical cancer. While caring for the client with a radioactive implant, the nurse should provide emotional support by spending additional time with the client. Stand at the foot of the bed when talking to the client. Avoid handling items used by the client. Wear a badge to monitor the amount of time spent in the client's room. Here are the options. Option A. Wear a badge to monitor the amount of time spent in the client's room. The correct answer is option A. Wear a badge to monitor the amount of time spent in the client's room. Correct answer. Wear a badge to monitor the amount of time spent in the client's room. Question 11. The physician is preparing to remove a central line. The nurse should tell the client to breathe normally, take slow, deep breaths, take a deep breath and hold it, breathe as quickly as possible. Here are the options. Option A. Take a deep breath and hold it. The correct answer is option A. Take a deep breath and hold it. Correct answer. Take a deep breath and hold it. Question 12. A client who uses a respiratory inhaler asks the nurse to explain how he can know when half his medication is empty so that he can refill his prescription. The nurse should tell the client to shake the inhaler and listen for the contents. Drop the inhaler in water to see if it floats. Check for a hissing sound as the inhaler is used. Press the inhaler and watch for the mist. Here are the options. Option A. Drop the inhaler in water to see if it floats. The correct answer is option A. Drop the inhaler in water to see if it floats. Correct answer. Drop the inhaler in water to see if it floats. Question 13. A client is admitted with a ruptured spleen following a four-wheeler accident. In preparation for surgery, the nurse suspects that the client is in the compensatory stage of shock because of which clinical manifestation? Blood pressure 120/70, confusion, heart rate 120 crackles on chest auscultation, mauled skin, lethargy jaundice, urine output less than 30 ml in the past hour, heart rate 170 rapid shallow respirations, unconscious, petechiae anterior chest. Here are the options. Option A. Blood pressure 120/70, confusion, heart rate 120 compensatory stage of shock, BP remains normal. The correct answer is option A. Blood pressure 120/70, confusion, heart rate 120 compensatory stage of shock, BP remains normal. Correct answer. Blood pressure 120/70, confusion, heart rate 120 compensatory stage of shock, BP remains normal. Question 14. A nurse is caring for a client with a myocardial infarction. The nurse recognizes that the most common complication in the client following a myocardial infarction is right ventricular hypertrophy, cardiac dysrhythmia, left ventricular hypertrophy, hyperkalemia. Here are the options. Option A. Cardiac dysrhythmia. The correct answer is option A. Cardiac dysrhythmia. Correct answer, cardiac dysrhythmia. Question 15. Which of the following statements best explains the rationale for placing the client in Trendelenburg position during the insertion of a central line catheter? It will facilitate catheter insertion. It will make the client more comfortable during the insertion. It will prevent the occurrence of ventricular tachycardia. It will prevent the development of pulmonary embolus. Here are the options. Option A. It will facilitate catheter insertion. The correct answer is option A. It will facilitate catheter insertion. Correct answer. It will facilitate catheter insertion. Question 16. A client is admitted to the emergency department with complaints of crushing chest pain that radiates to the left jaw. After obtaining a stat electrocardiogram, the nurse should obtain a history of prior cardiac problems, begin and Roman 4 using a large bore catheter, administer oxygen at 2 L per minute via nasal cannula, perform pupil checks for size and reaction to light. Here are the options. Option A. Administer oxygen at 2 L per minute via nasal cannula. The correct answer is option A. Administer oxygen at 2 L per minute via nasal cannula. Correct answer. Administer oxygen at 2 L per minute via nasal cannula. Question 17. The nurse is caring for a client following a myocardial infarction. Which of the following enzymes are specific to cardiac damage? SCOT and LDH, SCOT and CKBB, LDH and CKMB, LDH and CKBB. Here are the options. Option A. LDH and CKMB specific for diagnosing cardiac damage. The correct answer is option A. LDH and CKMB specific for diagnosing cardiac damage. Correct answer. LDH and CKMB specific for diagnosing cardiac damage. Question 18. A burn client's care plan reveals an expected outcome of no localized or systemic infection. Which assessment by the nurse supports this outcome? Wound culture results showing minimal, bacteria cloudy, foul-smelling urine, white blood cell count of 14, 0/mm3, temperature elevation of 101 degrees F. Here are the options. Option A. Wound culture results showing minimal bacteria. The correct answer is option A. Wound culture results showing minimal bacteria. Correct answer. Wound culture results showing minimal bacteria. Question 19. The home health nurse is visiting a client with an exacerbation of rheumatoid arthritis. To prevent deformities of the knee joints, the nurse should tell the client to walk without bending the knees, encourage movement within the limits of pain, instruct the client to sit only in a recliner, tell the client to remain in bed as long as the joints are painful. Here are the options. Option A. Encourage movement within the limits of pain. The correct answer is option A. Encourage movement within the limits of pain. Correct answer. Encourage movement within the limits of pain. Question 20. The nurse is caring for a client with cancer of the pancreas. Which finding indicates involvement of the bile ducts? Dark urine, petechiae, dark stools, steatorrhea. Here are the options. Option A. Dark urine, clay-colored stools, jaundice, and pruritus indicate involvement of bile ducts in a client with pancreatic cancer. The correct answer is option A. Dark urine, clay-colored stools, jaundice, and pruritus indicate involvement of bile ducts in the client with pancreatic cancer. Correct answer. Dark urine, clay-colored stools, jaundice, and pruritus indicate involvement of bile ducts in the client with pancreatic cancer. Question 21. The client has an order for sliding scale insulin at 19 hours and Lantus Glargine insulin at the same hour. The nurse should administer the two medications together. Administer the medications in 2 injections. Draw up the Lantus insulin and then the regular insulin and administer them together. Contact the doctor because these medications should not be given to the same client. Here are the options. Option A. Administer the medications in 2 injections. The correct answer is option A. Administer the medications in 2 injections. Correct answer. Administer the medications in 2 injections. Question 22. The nurse should carefully monitor the client for which common dysrhythmia that can occur during suctioning? Bradycardia, tachycardia, ventricular ectopic beat, sick sinus syndrome. Here are the options. Option A. Bradycardia. The correct answer is option A. Bradycardia. Correct answer. Bradycardia. Question 23. A client with rheumatoid arthritis has Sjogren's syndrome. The nurse can help relieve the symptoms of Sjogren's syndrome by providing heat to the joints, instilling eye drops, administering pain medication, providing small, frequent meals. Here are the options. Option A. Instilling eye drops to eyes. The correct answer is option A. Instilling eye drops to eyes. Correct answer. Instilling eye drops to eyes. Question 24. A client has developed diabetes insipidus after removal of a pituitary tumor. Which finding would the nurse expect? Polyuria, hypertension, polyphagia, hyperkalemia. Here are the options. Option A. Polyuria. The correct answer is option A. Polyuria. Correct answer. Polyuria. Question 25. The nurse is evaluating teaching effectiveness on a client with a gastrointestinal disorder prescribed a gluten-free diet. Which diet choice indicates that the client understands the instructions given? Steamed broccoli, wheat toast, chocolate chip cookie bran cereal. Here are the options. Option A. Steamed broccoli. The correct answer is option A. Steamed broccoli. Correct answer, steamed broccoli. Question 26. A client with pneumocystis gyropsy pneumonia is receiving intravenous pentamidine. While administering the medication, the nurse should give priority to checking the client's deep tendon reflexes, blood pressure, urine output, tissue turgor. Here are the options. Option A. Blood pressure if infused too rapidly can cause severe hypotension and hypoglycemia. The correct answer is option A. Blood pressure if infused too rapidly can cause severe hypotension and hypoglycemia. Correct answer. Blood pressure if infused too rapidly can cause severe hypotension and hypoglycemia. Question 27. A client with COP is in respiratory failure. Which of the following results would be the most sensitive indicator that the client requires a mechanical ventilator? PCO2 58 SAW2 90 pH 7.23 HCO3 30. Here are the options. Option A. pH 7.23. The correct answer is option A. pH 7.23. Correct answer. pH 7.23. Question 28. An elderly client with glaucoma has been prescribed Timoptic timolol eye drops. Timoptic should be used with caution in clients with a history of diabetes, gastric ulcers, emphysema, pancreatitis. Here are the options. Option A. Emphysema beta blockers such as timolol Timoptic can cause bronchospasm in the client with chronic obstructive lung disease. The correct answer is option A. Emphysema beta blockers such as timolol Timoptic can cause bronchospasm in the client with chronic obstructive lung disease. Correct answer. Emphysema beta blockers such as timolol Timoptic can cause bronchospasm in the client with chronic obstructive lung disease. Question 29. The nurse is caring for a client with suspected AIDS dementia complex. The first sign of dementia in the client with AIDS is changes in gait, loss of concentration, problems with speech, seizures. Here are the options. Option A. Loss of concentration. The correct answer is option A. Loss of concentration. Correct answer. Loss of concentration. Question 30. A client being treated with sodium warfarin Coumadin has a prothrombin time of 120 seconds. The nurse recognizes that close assessment for signs of bleeding is needed. The dosage of Coumadin is inadequate to prevent thrombi. The client should limit the intake of foods rich in vitamin K. Skip doses should be made up by taking an additional dose. Here are the options. Option A. Close assessment for signs of bleeding is needed. The correct answer is option A. Close assessment for signs of bleeding is needed. Correct answer. Close assessment for signs of bleeding is needed. Question 31. A client has a tentative diagnosis of myasthenia gravis. The nurse recognizes that myasthenia gravis involves loss of the myelin sheath in portions of the brain and spinal cord and interruption in the transmission of impulses from nerve endings to muscles, progressive weakness and loss of sensation that begins in the lower extremities, loss of coordination, and stiff cogwheel rigidity. Here are the options. Option A. An interruption in the transmission of impulses from nerve endings to muscles. The correct answer is option A. An interruption in the transmission of impulses from nerve endings to muscles. Correct answer. An interruption in the transmission of impulses from nerve endings to muscles. Question 32. The nurse has just admitted a client with emphysema. Arterial blood gas results indicate hypoxia. Which physician prescription would the nurse implement for the best improvement in the client's hypoxia? Elevate the head of the bed 45 degrees. Encourage diaphragmatic breathing. Initiate an elupant nebulizer treatment. Start O2 at 2L/min. Here are the options. Option A. Start O2 at 2L/min. The correct answer is option A. Start O2 at 2L/min. Correct answer. Start O2 at 2L/min. Question 33. Which vitamin should be administered with INH isoniazid in order to prevent possible nervous system side effects? Thiamine, niacin, pyridoxine, riboflavin. Here are the options. Option A. Pyridoxine vitamin B6 is usually administered with INH isoniazid. The correct answer is option A. Pyridoxine vitamin B6 is usually administered with INH isoniazid. Correct answer. Pyridoxine vitamin B6 is usually administered with INH isoniazid. Question 34. A client has suffered a severe electrical burn. Which medication would the nurse expect to have ordered for application to the burned area? Mafenide acetate, sulfamylin, silver nitrate, providoniodine ointment, silver sulfatazine, silbadine. Here are the options. Option A. Mafenide acetate, sulfamylin, topical agent of choice for electrical burns because of its ability to penetrate thick eschar. The correct answer is option A. Mafenide acetate, sulfamylin, topical agent of choice for electrical burns because of its ability to penetrate thick eschar. Correct answer. Mafenide acetate, sulfamylin, topical agent of choice for electrical burns because of its ability to penetrate thick eschar. Question 35. When administering total parenteral nutrition, the nurse should assess the client for signs of rebound hypoglycemia. The nurse knows that rebound hypoglycemia occurs when the infusion rate is too rapid. The infusion is discontinued without tapering. The solution is infused through a peripheral line. The infusion is administered without a filter. Here are the options. Option A. The infusion is discontinued without tapering. The correct answer is option A. The infusion is discontinued without tapering. Correct answer. The infusion is discontinued without tapering. Question 36. A client's admission history reveals complaints of fatigue, chronic sore throat, and enlarged lymph nodes in the axilla and neck. Which exam would assist the physician to make a tentative diagnosis of leukemia? A complete blood count, an X-ray of the chest, a bone marrow aspiration, a CT scan of the abdomen. Here are the options. Option A. A complete blood count. The correct answer is option A. A complete blood count. Correct answer. A complete blood count. Question 37. During morning assessments, the nurse finds that a client's nephrostomy tube has been clamped. The nurse's first action should be to assess the drainage bag, check for bladder distension, unclamp the tubing, irrigate the tubing. Here are the options. Option A. Unclamp the tubing. Should not be clamped or irrigated because of the damage that can result to the kidney. The correct answer is option A. Unclamp the tubing. Should not be clamped or irrigated because of the damage that can result to the kidney. Correct answer. Unclamp the tubing. Should not be clamped or irrigated because of the damage that can result to the kidney. Question 38. The physician has ordered a thyroid scan to confirm the diagnosis of a goiter. Before the procedure, the nurse should assess the client for allergies to iodine, bolus the client with Roman 4 fluid, administer an anxiolytic, insert a urinary catheter. Here are the options. Option A. Assess the client for allergies to iodine. The correct answer is option A. Assess the client for allergies to iodine. Correct answer. Assess the client for allergies to iodine. Question 39. The nurse is instructing a patient scheduled for abdominal surgery on the use of a flow-metered incentive spirometer. Which instruction would the nurse include in the teaching plan? Blow on the mouthpiece of the device fast for 3 breaths, followed by slow for 3 more breaths. Use the incentive spirometer once every morning. Inhale slowly on the device to elevate and maintain the flow indicator. Briskly inhale on the device, making sure the flow indicator does not rise. Here are the options. Option A. Inhale slowly on the device to elevate and maintain the flow indicator. The correct answer is option A. Inhale slowly on the device to elevate and maintain the flow indicator. Correct answer. Inhale slowly on the device to elevate and maintain the flow indicator. Question 40. The client with a pacemaker should be taught to report ankle edema, check his blood pressure daily, refrain from using a microwave oven, monitor his pulse rate. Here are the options. Option A. Monitor his pulse rate. The correct answer is option A. Monitor his pulse rate. Correct answer. Monitor his pulse rate. Question 41. The nurse is assessing the client with a total knee replacement 2 hours post-operative. Which information requires notification of the doctor? Scant bleeding on the dressing, low-grade temperature, hemoglobin of 7 gm/dl, urine output of 120 ml during the last hour. Here are the options. Option A. Hemoglobin of 7 gm/d low and might a blood transfusion might be required. The correct answer is option A. Hemoglobin of 7 gm/d low and might a blood transfusion might be required. Correct answer. Hemoglobin of 7 gm/d low and might a blood transfusion might be required. Question 42. The nurse is teaching a group of prenatal clients about the effects of cigarette smoke on fetal development. Which characteristic is associated with babies born to mothers who smoked during pregnancy? Low birth weight, large for gestational age, preterm birth, but appropriate size for gestation, growth retardation in weight and length. Here are the options. Option A. Low birth weight. The correct answer is option A. Low birth weight. Correct answer. Low birth weight. Question 43. A client has had diarrhea for the past 3 days. Which acid/base imbalance would the nurse expect the client to have? Respiratory alkalosis, metabolic acidosis, metabolic alkalosis, respiratory acidosis. Here are the options. Option A. Metabolic acidosis. The correct answer is option A. Metabolic acidosis. Correct answer. Metabolic acidosis. Question 44. The registered nurse is assigning staff for 4 clients on the 3-11 shift. Which client should be assigned to the LPN? A client with a diagnosis of adult respiratory distress syndrome (ARDS) who was transferred from the critical care unit at 1,400 AA 1 hour post-operative colon resection. A client with pneumonia expecting discharge in the morning. A client with cirrhosis of the liver experiencing bleeding from esophageal varices. Here are the options. Option A. A client with pneumonia expecting discharge in the morning. The correct answer is option A. A client with pneumonia expecting discharge in the morning. Correct answer. A client with pneumonia expecting discharge in the morning. Question 45. A client with hyperthyroidism is taking Escalith lithium carbonate to inhibit thyroid hormone release. Which complaint by the client should alert the nurse to a problem with the client's medication? The client complains of blurred vision. The client complains of increased thirst and increased urination. The client complains of increased weight gain over the past year. The client complains of rhinorrhea. Here are the options. Option A. The client complains of increased thirst and increased urination. The correct answer is option A. The client complains of increased thirst and increased urination. Correct answer. The client complains of increased thirst and increased urination. Question 46. After several hospitalizations for respiratory ailments, a 6-month-old has been diagnosed as having HIV. The infant's respiratory ailments were most likely due to pneumocystis gyropsy cytomegalovirus cryptis portiosis herpes simplex. Here are the options. Option A. Pneumocystis gyropsy. The correct answer is option A. Pneumocystis gyropsy. Correct answer, pneumocystis gyropsy. Question 47. A client has recently been diagnosed with primary open-angle glaucoma. The nurse should tell the client to avoid taking alevnaprocin, Benadryl, diphenhydramine, Tylenol, acetaminophen, robitussin, guaifenesin. Here are the options. Option A. Benadryl diphenhydramine antihistamines shouldn't be used by client with open-angle glaucoma. They dilate pupil and prevent outflow of aqueous humor. The correct answer is option A. Benadryl diphenhydramine antihistamines shouldn't be used by client with open-angle glaucoma. They dilate pupil and prevent outflow of aqueous humor. Correct answer. Benadryl diphenhydramine antihistamines shouldn't be used by client with open-angle glaucoma. They dilate pupil and prevent outflow of aqueous humor. Question 48. The nurse is caring for a client with epilepsy who is being treated with carbamazepine tegretol. Which laboratory value might indicate a serious side effect of this drug? B110 mg/dl hemoglobin 13.dl WBC4 ZBBS/EMM3 platelets 200 ZBBS/EMM3. Here are the options. Option A. WBC4 ZBP/MEM3 can cause bone marrow depression and cause problems with the liver. Raise the beam. The correct answer is option A. WBC4 ZBP/MEM3 can cause bone marrow depression and cause problems with the liver. Raise the beam. Correct answer. WBC4 ZBP/MEM3 can cause bone marrow depression and cause problems with the liver. Raise the beam. Question 49. A nurse is caring for a client in the critical care unit who is complaining of chest pain. Nursing assessment reveals a BP of 78/40, shortness of breath, and 3rd-degree AV block on the heart monitor. What is the most appropriate initial action? Provide transcutaneous pacing. Turn the client on his side. Reassess the blood pressure. Consult with cardiology. Here are the options. Option A. Provide transcutaneous pacing. Most appropriate initial action for heart block. The correct answer is option A. Provide transcutaneous pacing. Most appropriate initial action for heart block. Correct answer. Provide transcutaneous pacing. Most appropriate initial action for heart block. Question 50. A client with sickle cell disease is admitted in active labor. Which nursing intervention would be most helpful in preventing a sickling crisis? Obtaining blood pressures every 2 hours, administering pain medication every 3 hours as ordered, monitoring arterial blood gas results, administering Roman IV fluids at ordered rate of 200 ml/hr. Here are the options. Option A. Administering Roman IV fluids at ordered rate of 200 ml/hr prevents slowing of blood flow and occlusion. The correct answer is option A. Administering Roman IV fluids at ordered rate of 200 ml/hr prevents slowing of blood flow and occlusion. Correct answer. Administering Roman IV fluids at ordered rate of 200 ml/hr prevents slowing of blood flow and occlusion. Question 51. The intensive care unit is full and the emergency room just called in a report on a ventilator-dependent client who is being admitted to the medical surgical unit. It would be essential that the nurse have which piece of equipment at the client's bedside? Cardiac monitor, intravenous controller, manual resuscitator, oxygen by nasal cannula. Here are the options. Option A. Manual resuscitator. The correct answer is option A. Manual resuscitator. Correct answer. Manual resuscitator. Question 52. A 2-year-old is hospitalized with suspected intussusception. Which finding is associated with intussusception? Current jelly stools, projectile vomiting, ribbon-like stools, palpable mass over the flank. Here are the options. Option A. Current jelly stools. The correct answer is option A. Current jelly stools. Correct answer. Current jelly stools. Question 53. The nurse is assessing the integumentary system of a dark-skinned individual. Which area would be the most likely to show a skin cancer lesion? Chest, arms, face, palms. Here are the options. Option A. Palms. The correct answer is option A. Palms. Correct answer. Palms. Question 54. A client was transferred to the hospital unit as a direct admit. While the nurse is obtaining part of the admission history information, the client suddenly becomes semiconscious. Assessment reveals a systolic BP of 70, heart rate of 130, and respiratory rate of 24. What is the nurse's best initial action? Lower the head of the client's bed. Initiate an Roman IV with a large bore needle. Notify the physician of the assessment results. Call for the cardiopulmonary resuscitation team. Here are the options. Option A. Lower the head of the client's bed. Suspect a leaking or ruptured abdominal aortic aneurysm. The first action is to improve blood flow to the brain and elevate the blood pressure. The correct answer is option A. Lower the head of the client's bed. Suspect a leaking or ruptured abdominal aortic aneurysm. The first action is to improve blood flow to the brain and elevate the blood pressure. Correct answer. Lower the head of the client's bed. Suspect a leaking or ruptured abdominal aortic aneurysm. The first action is to improve blood flow to the brain and elevate the blood pressure. Question 55. The nurse is assessing elderly clients at a community center. Which of the following findings would be the most cause for concern? Dry mouth, loss of 1 inch of height in the last year, stiffened joints, rails bilaterally on chest auscultation. Here are the options. Option A. Rails bilaterally on chest auscultation. The correct answer is option A. Rails bilaterally on chest auscultation. Correct answer. Rails bilaterally on chest auscultation. Question 56. A client with hepatitis C who has cirrhosis changes has just returned from a liver biopsy. The nurse will place the client in which position? Trendelenburg supine, right side lying, left Sims. Here are the options. Option A. Right side lying. Hemorrhage can occur with liver biopsies. The client is positioned on the right side to keep pressure on the area and prevent bleeding. The correct answer is option A. Right side lying. Hemorrhage can occur with liver biopsies. The client is positioned on the right side to keep pressure on the area and prevent bleeding. Correct answer. Right side lying. Hemorrhage can occur with liver biopsies. The client is positioned on the right side to keep pressure on the area and prevent bleeding. Question 57. When administering a tuberculin skin test, the nurse should insert the needle at a 15 degrees angle, 30 degrees angle, 45 degrees angle, 90 degrees angle. Here are the options. Option A. 15 degrees angle. The correct answer is option A. 15 degrees angle. Correct answer. 15 degrees angle. Question 58. The nurse is assessing the arterial blood gases ABG of a chest trauma client with the results of pH 7.35, PO 285, PCO 255, and HEO 327. What do these values indicate? Uncompensated respiratory acidosis, uncompensated metabolic acidosis, compensated respiratory acidosis, compensated metabolic acidosis. Here are the options. Option A. Compensated respiratory acidosis. The correct answer is option A. Compensated respiratory acidosis. Correct answer. Compensated respiratory acidosis. Question 59. A client with cancer and metastases to the bone is admitted to the hospital. Which symptom of hypercalcemia causes the nurse the most concern? Weakness, anorexia, flaccid muscles, cardiac changes. Here are the options. Option A. Cardiac changes. The correct answer is option A. Cardiac changes. Correct answer. Cardiac changes. Question 60. The physician has prescribed Cobic cyanocobalamin for a client following a gastric resection. Which lab result indicates that the medication is having its intended effect? Neutrophil count of 4,500 qmm, HGB of 14.2 g/dl, platelet count of 250 qmm, eosinophil count of 200 qmm. Here are the options. Option A. HGB of 14.2 g/dlan, injectable form of cyanocobalamin or vitamin B12. The correct answer is option A. HGB of 14.2 g/dlan, injectable form of cyanocobalamin or vitamin B12. Correct answer. HGB of 14.2 g/dlan, injectable form of cyanocobalamin or vitamin B12. Question 61. A client is admitted with a diagnosis of renal calculi. The nurse should give priority to initiating an intravenous infusion, encouraging oral fluids, administering pain medication, straining the urine. Here are the options. Option A. Initiating an intravenous infusion, increasing fluid intake to 3 kml/day will help prevent obstruction by increasing the output. The correct answer is option A. Initiating an intravenous infusion, increasing fluid intake to 3 kml/day will help prevent obstruction by increasing the output. Correct answer. Initiating an intravenous infusion, increasing fluid intake to 3 kml/day will help prevent obstruction by increasing the output. Question 62. The nurse is performing a neurological assessment on a client admitted with TIAs. Assessment findings reveal an absence of the gag reflex. The nurse suspects injury to which of the following cranial nerves? Roman 12 hypoglossal X vagus, Roman 9 glossopharyngeal, Roman 7 facial. Here are the options. Option A. X vagus. The correct answer is option A. X vagus. Correct answer, X vagus. Question 63. The nurse recognizes which of the following clients as having the highest risk for pulmonary complications after surgery? A 24-year-old with open reduction internal fixation of the ulnar, a 45-year-old with an open cholecystectomy, a 36-year-old after a hysterectomy, a 50-year-old after a lumbar laminectomy. Here are the options. Option A. A 45-year-old with an open cholecystectomy. The correct answer is option A. A 45-year-old with an open cholecystectomy. Correct answer. A 45-year-old with an open cholecystectomy. Question 64. A nurse is observing a local softball game when one of the players is hit in the nose with a ball. The player's nose is visibly deformed and bleeding. The best way for the nurse to control the bleeding is to tilt the head back and pinch the nostrils. Apply a wrapped ice compress to the nose. Pack the nose with soft, clean tissue. Tilt the head forward and pinch the nostrils. Here are the options. Option A. Apply a wrapped ice compress to the nose. The correct answer is option A. Apply a wrapped ice compress to the nose. Correct answer. Apply a wrapped ice compress to the nose. Question 65. The nurse is caring for a client with a diagnosis of hepatitis who is experiencing pruritus. Which would be the most appropriate nursing intervention? Suggest that the client take warm showers. Add baby oil to the client's bath water. Apply powder to the client's skin. Suggest a hot water rinse after bathing. Here are the options. Option A. Add baby oil to the client's bath water. The correct answer is option A. Add baby oil to the client's bath water. Correct answer. Add baby oil to the client's bath water. Question 66. The elderly client is admitted to the emergency room. Which symptom is the client with the fractured hip most likely to exhibit? Pain, disalignment, cool extremity, absence of pedal pulses. Here are the options. Option A. Disalignment. The correct answer is option A. Disalignment. Correct answer. Disalignment. Question 67. The physician has prescribed Gantrezin sulfasoxazole 1 g in divided doses for a client with a urinary tract infection. The nurse should administer the medication with meals or a snack 30 minutes before meals, 30 minutes after meals, 30 minutes after meals. Here are the options. Option A. 30 minutes before meals. The correct answer is option A. 30 minutes before meals. Correct answer, 30 minutes before meals. Question 68. A client is diagnosed with stage Roman II Hodgkin's lymphoma. The nurse recognizes that the client has involvement in a single lymph node or single site in more than one node or single organ on the same side of the diaphragm in lymph nodes on both sides of the diaphragm in disseminated organs and tissues. Here are the options. Option A. In more than one node or single organ on the same side of the diaphragm. The correct answer is option A. In more than one node or single organ on the same side of the diaphragm. Correct answer. In more than one node or single organ on the same side of the diaphragm. Question 69. A client with cancer received platelet infusions 24 hours ago. Which of the following assessment findings would indicate the most therapeutic effect from the transfusions? Hemoglobin level increase from 8.9 to 10.6 mg/dL, temperature reading of 99.4 degrees F, white blood cell count of 11, 0/mm3, decrease in oozing of blood from Roman IV site. Here are the options. Option A. Decrease in oozing of blood from Roman IV site. The correct answer is option A. Decrease in oozing of blood from Roman IV site. Correct answer. Decrease in oozing of blood from Roman IV site. Question 70. The nurse is assessing a client following the removal of a pituitary tumor. The nurse notes that the urinary output has increased and that the urine is very dilute. The nurse should give priority to notifying the doctor immediately, documenting the finding in the chart, decreasing the rate of Roman IV fluids, administering vasopressive medication. Here are the options. Option A. Notifying the doctor immediately, diabetes insipidus. The correct answer is option A. Notifying the doctor immediately, diabetes insipidus. Correct answer. Notifying the doctor immediately, diabetes insipidus. Question 71. A client with human immunodeficiency syndrome has gastrointestinal symptoms, including diarrhea. The nurse should teach the client to avoid calcium-rich foods, canned or frozen vegetables, processed meat, raw fruits and vegetables. Here are the options. Option A. Raw fruits and vegetables. The correct answer is option A. Raw fruits and vegetables. Correct answer, raw fruits and vegetables. Question 72. A client is admitted with a diagnosis of pernicious anemia. Which of the following signs or symptoms would indicate that the client has been non-compliant with ordered B12 injections? Hyperactivity in the evening hours, weight gain, paresthesia of hands and feet, diarrhea, stools. Here are the options. Option A. Paresthesia of hands and feet. B12 deficit will have symptoms such as paresthesia. The correct answer is option A. Paresthesia of hands and feet. B12 deficit will have symptoms such as paresthesia. Correct answer. Paresthesia of hands and feet. B12 deficit will have symptoms such as paresthesia. Question 73. The Mantoux test is used to determine whether a person has been exposed to tuberculosis. If the test is positive, the nurse will find a fluid-filled vesicle, sharply demarcated erythema, central area of induration, circular blanched area. Here are the options. Option A. Central area of induration. Positive Mantoux test is indicated by the presence of induration. The correct answer is option A. Central area of induration. Positive Mantoux test is indicated by the presence of induration. Correct answer. Central area of induration. Positive Mantoux test is indicated by the presence of induration. Question 74. The nurse is preparing a client for cervical uterine radiation implant insertion. Which will be included in the teaching plan? TV or telephone use will not be allowed while the implant is in place. A Foley catheter is usually inserted. A high-fiber diet is recommended. Excretions will be considered radioactive. Here are the options. Option A. A Foley catheter is usually inserted. A catheter will allow urine elimination without disrupting the implant. The correct answer is option A. A Foley catheter is usually inserted. A catheter will allow urine elimination without disrupting the implant. Correct answer. A Foley catheter is usually inserted. A catheter will allow urine elimination without disrupting the implant. Question 75. A client with multiple sclerosis has an order to receive Solumedrol 200 mg Roman 4 push. The available dose is Solumedrol 250 mg per ml. How much medication will the nurse administer? 0.5 ml, 0.8 ml, 1.1 ml, 1.4 ml. Here are the options. Option A. 0.8 ml. The correct answer is option A. 0.8 ml. Correct answer. 0.8 ml. Question 76. There is an order for a trough level to be drawn on the client receiving vancomycin and vancomycin. The nurse is aware that the lab should collect the blood 15 minutes after the infusion prior to the fourth infusion, 1 hour after the infusion, 2 hours before the second infusion. Here are the options. Option A. Prior to the fourth infusion. The correct answer is option A. Prior to the fourth infusion. Correct answer. Prior to the fourth infusion. Question 77. A client is admitted with a diagnosis of polycythemia vera. The nurse should closely monitor the client for increased blood pressure, decreased respirations, increased urinary output, decreased oxygen saturation. Here are the options. Option A. Increased blood pressure, abnormal increase in the number of circulating red blood cells that results in increased viscosity. The correct answer is option A. Increased blood pressure, abnormal increase in the number of circulating red blood cells that results in increased viscosity. Correct answer. Increased blood pressure, abnormal increase in the number of circulating red blood cells that results in increased viscosity. Question 78. Intraarterial chemotherapy primarily benefits the client by applying greater concentrations of medication directly to the malignant tumor. An additional benefit of intraarterial chemotherapy is prevention of nausea and vomiting, treatment of micrometastases, eradication of bone pain, prevention of therapy-induced anemia. Here are the options. Option A. Treatment of micrometastases. The correct answer is option A. Treatment of micrometastases. Correct answer. Treatment of micrometastases. Question 79. A client has ataxia following a cerebral vascular accident. The nurse should supervise the client's ambulation, measure the client's intake and output, request a consult for speech therapy, provide the client with a magic slate. Here are the options. Option A. Supervise the client's ambulation. Affects the client's mobility, making falls more likely. The correct answer is option A. Supervise the client's ambulation. Affects the client's mobility, making falls more likely. Correct answer. Supervise the client's ambulation. Affects the client's mobility, making falls more likely. Question 80. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should be taught to avoid using which condiment? Mustard, salt, pepper, ketchup. Here are the options. Option A. Pepper is unprocessed and may contain bacteria. The correct answer is option A. Pepper is unprocessed and may contain bacteria. Correct answer. Pepper is unprocessed and may contain bacteria. Question 81. The nurse caring for a client with a suspected peptic ulcer recognizes which exam as the one most reliable in diagnosing the disease? Upper gastrointestinal X-ray, gastric analysis, endoscopy procedure, barium studies, X-ray. Here are the options. Option A. Endoscopy procedure. The correct answer is option A. Endoscopy procedure. Correct answer. Endoscopy procedure. Question 82. The physician has ordered a low-residue diet for a client with Crohn's disease. Which food is not permitted in a low-residue diet? Mashed potatoes, smooth peanut butter, fried fish, rice. Here are the options. Option A. Fried fish. Fried foods are not permitted on a low-residue diet. The correct answer is option A. Fried fish. Fried foods are not permitted on a low-residue diet. Correct answer. Fried fish. Fried foods are not permitted on a low-residue diet. Question 83. The physician has prescribed cyclogel cyclopentolate hydrochloride drops for a client following a scleral buckling. The nurse knows that the purpose of the medication is to rest the muscles of accommodation, prevent post-operative infection, constrict the pupils, reduce the production of aqueous humor. Here are the options. Option A. Rest the muscles of accommodation. It's a cycloplegic medication that inhibits constriction of the pupil. The correct answer is option A. Rest the muscles of accommodation. It's a cycloplegic medication that inhibits constriction of the pupil. Correct answer. Rest the muscles of accommodation. It's a cycloplegic medication that inhibits constriction of the pupil. Question 84. A client with B-negative blood requires a blood transfusion during surgery. If no B-negative blood is available, the client should be transfused with A positive blood, B positive blood, O negative blood, AB negative blood. Here are the options. Option A. O negative blood. The correct answer is option A. O negative blood. Correct answer. O negative blood. Question 85. The nurse is admitting a client with a suspected duodenal ulcer. The client will most likely report that his abdominal discomfort decreases when he avoids eating, rests in a recumbent position, eats a meal or snack, sits upright after eating. Here are the options. Option A. Eats a meal or snack. The correct answer is option A. Eats a meal or snack. Correct answer. Eats a meal or snack. Question 86. A client with a history of diverticulitis complains of abdominal pain, fever, and diarrhea. Which food is most likely responsible for the client's symptoms? Mashed potatoes, steamed carrots, baked fish, whole grain cereal. Here are the options. Option A. Whole grain cereal. The correct answer is option A. Whole grain cereal. Correct answer. Whole grain cereal. Question 87. A client with an esophageal tamponade develops symptoms of respiratory distress, including inspiratory stridor. The nurse should give priority to applying oxygen at 4L via nasal cannula, removing the tube after deflating the balloons, elevating the head of the bed to 45 degrees, increasing the pressure in the esophageal balloon. Here are the options. Option A. Removing the tube after deflating the balloons. The correct answer is option A. Removing the tube after deflating the balloons. Correct answer: removing the tube after deflating the balloons. Question 88. The client is instructed regarding foods that are low in fat and cholesterol. Which diet selection is lowest in saturated fats? Macaroni and cheese, shrimp with rice, turkey breast, spaghetti with meat sauce. Here are the options. Option A. Turkey breast. The correct answer is option A. Turkey breast. Correct answer: turkey breast. Question 89. Which of the following findings would be expected in the infant with biliary atresia? Rapid weight gain and hepatomegaly, dark stools and poor weight gain, abdominal distension and poor weight gain, abdominal distension and rapid weight gain. Here are the options. Option A. Abdominal distension and poor weight gain, abdominal distension, poor weight gain, and clay-colored stools. The correct answer is option A. Abdominal distension and poor weight gain, abdominal distension, poor weight gain, and clay-colored stools. Correct answer: abdominal distension and poor weight gain, abdominal distension, poor weight gain, and clay-colored stools. Question 90. The nurse caring for a client with a closed head injury obtains an intracranial pressure ICP reading of 17 mmHg. The nurse recognizes that the ICP is elevated and the doctor should be notified. The ICP is normal, therefore no further action is needed. The ICP is low and the client needs additional Roman IV fluids. The ICP reading is not as reliable as the Glasgow Coma Scale. Here are the options. Option A. The ICP is elevated and the doctor should be notified. The ICP normally ranges from 4 mmHg to 10 mmHg, with upper limits of 15 mmHg. The correct answer is option A. The ICP is elevated and the doctor should be notified. The ICP normally ranges from 4 mmHg to 10 mmHg, with upper limits of 15 mmHg. Correct answer: the ICP is elevated and the doctor should be notified. The ICP normally ranges from 4 mmHg to 10 mmHg, with upper limits of 15 mmHg. Question 91. The nurse in the emergency room is caring for a client with multiple rib fractures and a pulmonary contusion. Assessment reveals a respiratory rate of 38, a heart rate of 136, and restlessness. Which associated assessment finding would require immediate intervention? Occasional small amounts of hemoptysis midline trachea with wheezing on auscultation, subcutaneous air, and absent breath sounds, pain when breathing deeply, with rales in the upper lobes. Here are the options. Option A. Subcutaneous air and absent breath sounds with increased heart rate, dyspnea, and restlessness indicate a pneumothorax. The correct answer is option A. Subcutaneous air and absent breath sounds with increased heart rate, dyspnea, and restlessness indicate a pneumothorax. Correct answer: subcutaneous air and absent breath sounds with increased heart rate, dyspnea, and restlessness indicate a pneumothorax. Question 92. The nurse is caring for a client who is recovering from a fractured femur. Which diet selection would be best for this client? Loaded baked potato, fried chicken, and tea-dressed cheeseburger, French fries, and a Diet Coke tuna fish salad on sourdough bread, potato chips and skim milk mandarin orange salad, broiled chicken, and milk. Here are the options. Option A: mandarin orange salad, broiled chicken, and milk. The correct answer is option A: mandarin orange salad, broiled chicken, and milk. Correct answer: mandarin orange salad, broiled chicken, and milk. Question 93. A client with AIDS complains of a weight loss of 20 pounds in the past month. Which diet is suggested for the client with AIDS? High calorie, high protein, high fat, high calorie, high carbohydrate, low protein, high calorie, low carbohydrate, high fat, high calorie, high protein, low fat. Here are the options. Option A: high calorie, high protein, low fat. The correct answer is option A: high calorie, high protein, low fat. Correct answer: high calorie, high protein, low fat. Question 94. The nurse is reviewing the lab reports of a client who is HIV positive. Which lab report provides information regarding the effectiveness of the client's medication regimen? ELISA Western blot viral load CD4 count. Here are the options. Option A: viral load. The correct answer is option A: viral load. Correct answer: viral load. Question 95. A client taking Dilantin phenytoin for tonic-clonic seizures is preparing for discharge. Which information should be included in the client's discharge care plan? The medication can cause dental staining. The client will need to avoid a high-carbohydrate diet. The client will need a regularly scheduled blood work. The medication can cause problems with drowsiness. Here are the options. Option A: the client will need a regularly scheduled blood work. Adverse effects of Dilantin include agranulocytosis and aplastic anemia. The correct answer is option A: the client will need a regularly scheduled blood work. Adverse effects of Dilantin include agranulocytosis and aplastic anemia. Correct answer: the client will need a regularly scheduled blood work. Adverse effects of Dilantin include agranulocytosis and aplastic anemia. Question 96. A client with non-tropical sprue has an exacerbation of symptoms. Which meal selection is responsible for the recurrence of the client's symptoms? Tossed salad with oil and vinegar dressing, baked potato with sour cream and chives, cream of tomato soup and crackers, mixed fruit, and yogurt. Here are the options. Option A: cream of tomato soup and crackers like celiac caused by the ingestion of gluten found in wheat, oats, barley, and rye. The correct answer is option A: cream of tomato soup and crackers like celiac caused by the ingestion of gluten found in wheat, oats, barley, and rye. Correct answer: cream of tomato soup and crackers like celiac caused by the ingestion of gluten found in wheat, oats, barley, and rye. Question 97. The physician has ordered injections of Numiga Oprovacan for client receiving chemotherapy for prostate cancer. Which finding suggests that the medication is having its desired effect? 8-12.8D platelets 2FT, ZMBN-3 neutrophils 4, ZMBN-3 RBC 4.7 million. Here are the options. Option A: Platelets 250 in MEM3 stimulates the production of platelets. The correct answer is option A. Platelets 250 in MEM3 stimulates the production of platelets. Correct answer. Platelets 250 MM3 stimulates the production of platelets. Question 98. The mother of a child with cystic fibrosis tells the nurse that her child makes snoring sounds when breathing. The nurse is aware that many children with cystic fibrosis have choanal atresia, nasal polyp, septal deviations, enlarged adenoids. Here are the options. Option A. Nasal polyps. The correct answer is option A. Nasal polyps. Correct answer, nasal polyps. Question 99. A client has signs of increased intracranial pressure. Which one of the following is an early indicator of deterioration in the client's condition? Widening pulse pressure, decrease in the pulse rate, dilated, fixed pupils, decrease in level of consciousness. Here are the options. Option A. Decrease in level of consciousness. The correct answer is option A. Decrease in level of consciousness. Correct answer. Decrease in level of consciousness. Question 100. A client's chest tube drainage device has continuous bubbling in the water seal chamber. What is the nurse checking for when she clamps different areas of the tube to find out where the bubbling stops? An air leak in the system, the suction being too high, the suction being too low, attention pneumothorax. Here are the options. Option A. An air leak in the system, clamping various areas of the tube allows the nurse to assess for a leak in the tubing. When the bubbling stops. The correct answer is option A. An air leak in the system, clamping various areas of the tube allows the nurse to assess for a leak in the tubing. When the bubbling stops. Correct answer. An air leak in the system, clamping various areas of the tube allows the nurse to assess for a leak in the tubing. When the bubbling stops. Question 101. The physician has ordered an infusion of osmotrol mannitol for a client with increased intracranial pressure. Which finding indicates the direct effectiveness of the drug? Increased pulse rate, increased urinary output, decreased diastolic blood pressure, increased pupil size. Here are the options. Option A. Increased urinary output. Osmotic diuresis inhibits reabsorption of sodium and water. The correct answer is option A. Increased urinary output. Osmotic diuresis inhibits reabsorption of sodium and water. Correct answer. Increased urinary output. Osmotic diuresis inhibits reabsorption of sodium and water. Question 102. A client with osteoarthritis has a prescription for celecoxib. Which instruction should be included in the discharge teaching? Take the medication with milk. Report chest pain to the physician. Remain upright 30 minutes after taking the medication. Allow 6 weeks for optimal effects. Here are the options. Option A. Report chest pain to the physician. COX Roman 2 inhibitor associated with heart attacks and strokes. The correct answer is option A. Report chest pain to the physician. COX Roman 2 inhibitor associated with heart attacks and strokes. Correct answer. Report chest pain to the physician. COX Roman 2 inhibitor associated with heart attacks and strokes. Question 103. The nurse is formulating a plan of care for a client with a goiter. The priority nursing diagnosis for the client with a goiter is body image disturbance related to enlargement of the neck, activity intolerance related to fatigue, nutrition imbalance, less than body requirements, related to increased metabolism. Risk for ineffective airway clearance related to pressure of goiter on the trachea. Here are the options. Option A. Risk for ineffective airway clearance related to pressure of goiter on the trachea. The correct answer is option A. Risk for ineffective airway clearance related to pressure of goiter on the trachea. Correct answer. Risk for ineffective airway clearance related to pressure of goiter on the trachea. Question 104. The nurse is evaluating cerebral perfusion outcomes for a client with a subdural hematoma. The nurse evaluates which of the following is a favorable outcome for this client? Arterial blood gas PO2 of 98, increase in lethargy, pupils slow to react to light, temperature of 101 degrees F. Here are the options. Option A. Arterial blood gas PO2 of 98 indicates adequate oxygenation and a favorable outcome. The correct answer is option A. Arterial blood gas PO2 of 98 indicates adequate oxygenation and a favorable outcome. Correct answer. Arterial blood gas PO2 of 98 indicates adequate oxygenation and a favorable outcome. Question 105. The nurse is providing dietary instructions for a client with iron deficiency anemia. Which food is a poor source of iron? Tomatoes, legumes, dried fruits, nuts. Here are the options. Option A. Tomatoes, poor source of iron, although they are an excellent source of vitamin C, which increases iron absorption. The correct answer is option A. Tomatoes, poor source of iron, although they are an excellent source of vitamin C, which increases iron absorption. Correct answer. Tomatoes, poor source of iron, although they are an excellent source of vitamin C, which increases iron absorption. Question 106. The nurse is making assignments for the day. The staff consists of an RN, a novice RN, an LPN, and a nursing assistant. Which client should be assigned to the RN? A client with peptic ulcer disease, a client with skeletal traction for a fractured femur, a client with an abdominal cholecystectomy, a client with an esophageal tamponade. Here are the options. Option A. A client with an esophageal tamponade used to control bleeding in the client with esophageal varices. The correct answer is option A. A client with an esophageal tamponade used to control bleeding in the client with esophageal varices. Correct answer. A client with an esophageal tamponade used to control bleeding in the client with esophageal varices. Question 107. A client with a head injury develops syndrome of inappropriate antidiuretic hormone SIAD. Which physician prescription would the nurse question? D5W at 200 ml/HR, democlocycline, diclomycin 150 mg, Q6H, daily weights, monitor intake and output. Here are the options. Option A. D5W at 200 ml/HR, fluid restriction is part of the treatment plan, gives the client too much fluid volume. The correct answer is option A. D5W at 200 ml/HR, fluid restriction is part of the treatment plan, gives the client too much fluid volume. Correct answer. D5W at 200 ml/HR, fluid restriction is part of the treatment plan, gives the client too much fluid volume. Question 108. The nurse is caring for a client after a motor vehicle accident. The client has a fractured tibia and bone is noted protruding through the skin. Which action is of priority? Provide manual traction above and below the leg, cover the bone area with a sterile dressing. Apply an ACE bandage around the entire lower limb. Place the client in the prone position. Here are the options. Option A. Cover the bone area with a sterile dressing. The correct answer is option A. Cover the bone area with a sterile dressing. Correct answer. Cover the bone area with a sterile dressing. Question 109. A client is discharged home with a prescription for Coumadin sodium warfarin. The client should be instructed to avoid antihistamines containing diphenhydramine, increase the intake of all vegetables, have a PTT checked monthly, have a CBC drawn every 6 months. Here are the options. Option: avoid antihistamines containing diphenhydramine. It can increase the bleeding time. The correct answer is option A. Avoid antihistamines containing diphenhydramine. It can increase the bleeding time. Correct answer. Avoid antihistamines containing diphenhydramine. It can increase the bleeding time. Question 110. The nurse is performing discharge teaching for a client after a cardiac catheterization. Which statement by the client indicates a need for further teaching? I should not bend, strain, or lift heavy objects for 1 day. If bleeding occurs, I should place an ice bag on the site for 10 minutes. I need to call the doctor if my temperature goes above 101 degrees F. I should talk to the doctor to find out when I can go back to work. Here are the options. Option A. If bleeding occurs, I should place an ice bag on the site for 10 minutes. Any bleeding, new bruising, or pain at the puncture site, the physician should be notified. The correct answer is option A. If bleeding occurs, I should place an ice bag on the site for 10 minutes. Any bleeding, new bruising, or pain at the puncture site, the physician should be notified. Correct answer. If bleeding occurs, I should place an ice bag on the site for 10 minutes. Any bleeding, new bruising, or pain at the puncture site, the physician should be notified. Question 111. The nurse is preparing to discharge a client following a laparoscopic cholecystectomy. The nurse should tell the client to avoid a tub bath for 48 hours. Tell the client to expect clay-colored stools. Tell the client that she can expect lower abdominal pain for the next week. Tell the client to report pain in the back or shoulders. Here are the options. Option A. Tell the client to avoid a tub bath for 48 hours. The correct answer is option A. Tell the client to avoid a tub bath for 48 hours. Correct answer. Tell the client to avoid a tub bath for 48 hours. Question 112. Which finding is the best indication that a client with ineffective airway clearance needs suctioning? Oxygen saturation, respiratory rate, breath sounds, arterial blood gases. Here are the options. Option A. Breath sounds. The correct answer is option A. Breath sounds. Correct answer, breath sounds. Question 113. A client taking antiretroviral drugs reports his last blood work showed a drop of 3 units in the viral load. The nurse understands that the virus is no longer detectable. 90% of the viral load has been eliminated. 95% of the viral load has been eliminated. 99% of the viral load has been eliminated. Here are the options. Option A. 99% of the viral load has been eliminated. A drop of 3 units indicates that the viral load has decreased by 99%. The correct answer is option A. 99% of the viral load has been eliminated. A drop of 3 units indicates that the viral load has decreased by 99%. Correct answer. 99% of the viral load has been eliminated. A drop of 3 units indicates that the viral load has decreased by 99%. Question 114. Which of the following nursing interventions has the highest priority for the client scheduled for an intravenous pyelogram? Providing the client with a favorite meal for dinner, asking if the client has allergies to shellfish, encouraging fluids the evening before the test, telling the client what to expect during the test. Here are the options. Option A. Asking if the client has allergies to shellfish. The correct answer is option A. Asking if the client has allergies to shellfish. Correct answer. Asking if the client has allergies to shellfish. Question 115. The client presents to the clinic with a serum cholesterol of 275 mg/dl and is placed on rosuvastatin Crestor. Which instruction should be given to the client taking rosuvastatin Crestor? Report unexplained muscle weakness to the physician. Allow 6 months for the drug to take effect. Take the medication with fruit juice. Report difficulty sleeping. Here are the options. Option A. Report unexplained muscle weakness to the physician. Antilipidemic. The correct answer is option A. Report unexplained muscle weakness to the physician. Antilipidemic. Correct answer. Report unexplained muscle weakness to the physician. Antilipidemic. Question 116. A client hospitalized for treatment of congestive heart failure is to be discharged with a prescription for Digatec Digoxin 0.25 mg daily. Which of the following statements indicates that the client needs further teaching? I will need to take the medication at the same time each day. I can prevent stomach upset by taking the medication with an antacid. I can help prevent drug toxicity by eating foods containing fiber. I will need to report visual changes to my doctor. Here are the options. Option A. I can prevent stomach upset by taking the medication with an antacid. The correct answer is option A. I can prevent stomach upset by taking the medication with an antacid. Correct answer. I can prevent stomach upset by taking the medication with an antacid. Question 117. The physician has ordered an MRI as a part of the client's diagnostic workup. An MRI should not be done if the client has the need for oxygen therapy, a history of claustrophobia, a permanent pacemaker, sensory deafness. Here are the options. Option A. A permanent pacemaker. The correct answer is option A. A permanent pacemaker. Correct answer. A permanent pacemaker. Question 118. The nurse is caring for a client with rheumatoid arthritis. The nurse knows that the client's early morning symptoms will be most improved by taking a warm shower upon awakening, applying ice packs to the joints, taking 2 aspirin before going to bed, going for an early morning walk. Here are the options. Option A. Taking a warm shower upon awakening. The correct answer is option A. Taking a warm shower upon awakening. Correct answer. Taking a warm shower upon awakening. Question 119. The nurse is performing a physical assessment on a newly admitted client. The last step in the physical assessment is inspection, auscultation, percussion, palpation. Here are the options. Option A. Palpation. The correct answer is option A. Palpation. Correct answer. Palpation. Question 120. The physician orders the removal of an indwelling catheter the second post-operative day for a client with a prostatectomy. The client complains of pain and dribbling of urine the first time he voids. The nurse should tell the client that Using warm compresses over the bladder will lessen the discomfort. Perineal exercises will be started in a few days to help relieve his symptoms. If the symptoms don't improve, the catheter will have to be reinserted. His complaints are common and will improve over the next few days. Here are the options. Option A. His complaints are common and will improve over the next few days. The correct answer is option A. His complaints are common and will improve over the next few days. Correct answer. His complaints are common and will improve over the next few days. Question 121. The glycosylated hemoglobin of a 40-year-old client with diabetes mellitus is 2.5%. The nurse understands that the client can have a higher calorie diet. The client has good control of her diabetes. The client requires adjustment in her insulin dose. The client has poor control of her diabetes. Here are the options. Option A. The client has good control of her diabetes. The correct answer is option A. The client has good control of her diabetes. Correct answer. The client has good control of her diabetes. Question 122. A student nurse is observing a neurological nurse perform an assessment. When the nurse asks the client to stick out his tongue, the nurse is assessing the function of which cranial nerve? Roman 2 optic I olfactory X vagus Roman 12 hypoglossal. Here are the options. Option A. Roman 12 hypoglossal. The correct answer is option A. Roman 12 hypoglossal. Correct answer, Roman 12 hypoglossal. Question 123. The nurse is reviewing the lab results of a client's arterial blood gases. The PaCO2 indicates effective functioning of the kidneys, pancreas, lungs, liver. Here are the options. Option A. Lungs. The correct answer is option A. Lungs. Correct answer, lungs. Question 124. A client with a C3 spinal cord injury experiences autonomic hyperreflexia. After placing the client in high Fowler's position, the nurse's next action should be to notify the physician, make sure the catheter is patent, administer an antihypertensive, provide supplemental oxygen. Here are the options. Option A. Make sure the catheter is patent, raising the client's head to lower the blood pressure. The correct answer is option A. Make sure the catheter is patent, raising the client's head to lower the blood pressure. Correct answer. Make sure the catheter is patent, raising the client's head to lower the blood pressure. Question 125. 4 clients are admitted to a medical unit. If only one private room is available, it should be assigned to the client with ulcerative colitis, the client with neutropenia, the client with cholecystitis, the client with polycythemia vera. Here are the options. Option A. The client with neutropenia. The correct answer is option A. The client with neutropenia. Correct answer, the client with neutropenia. Question 126. Which diet is associated with an increased risk of colorectal cancer? Low protein, complex carbohydrates, high protein, simple carbohydrates, high fat, refined carbohydrates, low carbohydrates, complex proteins. Here are the options. Option A. High fat, refined carbohydrates. The correct answer is option A. High fat, refined carbohydrates. Correct answer, high fat, refined carbohydrates. Question 127. Hyperstat diazoxide is ordered for a patient with hypertension. Which side effect is associated with the medication? Photophobia, numbness of the hands, urinary frequency, alopecia. Here are the options. Option A, numbness of the hands. The correct answer is option A, numbness of the hands. Correct answer, numbness of the hands. Question 128. The nurse is reviewing the lab reports on several clients. Which one should be reported to the physician immediately? A serum creatinine of 5.2 mg/dl in a client with chronic renal failure, a positive C-reactive protein in a client with rheumatic fever, a hematocrit of 52% in a client with gastroenteritis, a white cell count of 200 Cu/mm, and a client taking dilantin phenytoin. Here are the options. Option A, a white cell count of 200 Cu/mm in a client taking dilantin phenytoin. The correct answer is option A, a white cell count of 200 Cu/mm in a client taking dilantin phenytoin. Correct answer, a white cell count of 200 Cu/mm in a client taking dilantin phenytoin. Question 129. The nurse has performed nutritional teaching on a client with gout who is placed on a low-purine diet. Which selection by the client would indicate that teaching has been ineffective? Boiled cabbage, apple, peach cobbler, spinach. Here are the options. Option A, spinach. Spinach should be avoided on a low-purine diet. Other foods to avoid include poultry, liver, lobster, oysters, peas, fish, and oatmeal. The correct answer is option A, spinach. Spinach should be avoided on a low-purine diet. Other foods to avoid include poultry, liver, lobster, oysters, peas, fish, and oatmeal. Correct answer, spinach. Spinach should be avoided on a low-purine diet. Other foods to avoid include poultry, liver, lobster, oysters, peas, fish, and oatmeal. Question 130. The nurse is caring for a client in the acute care unit. Initial laboratory values reveal serum sodium of 156 mg/L. What behavior changes would the nurse expect the client to exhibit? Hyporeflexia, manic behavior, depression, muscle cramps. Here are the options. Option A, manic behavior. The correct answer is option A, manic behavior. Correct answer, manic behavior. Question 131. The physician has diagnosed a client with cirrhosis characterized by asterixis. If the nurse assesses the client with asterixis, he can expect to find irregular movement of the wrist, enlargement of the breasts, dilated veins around the umbilicus, redness of the palmar surfaces. Here are the options. Option A, irregular movement of the wrist, flapping, tremors, irregular flexion and extension of wrists when arms are extended and wrist is hyperextended with the fingers separated. The correct answer is option A, irregular movement of the wrist, flapping, tremors, irregular flexion and extension of wrists when arms are extended and wrist is hyperextended with the fingers separated. Correct answer, irregular movement of the wrist, flapping, tremors, irregular flexion and extension of wrists when arms are extended and wrist is hyperextended with the fingers separated. Question 132. The client with color blindness will have problems distinguishing which of the following colors? Orange, violet, red, yellow. Here are the options. Option A, violet, violets, blues, and green. The correct answer is option A, Violet, violets, blues, and green. Correct answer: violet, violets, blues, and green. Question 133. The nurse is caring for a client post-op femoral popliteal bypass graft. Which post-operative assessment finding would require immediate physician notification? Edema of the extremity and pain at the incision site, a temperature of 99.6 degrees F, and redness of the incision, serous drainage noted at the surgical area, a loss of posterior tibial and dorsalis pedis pulses. Here are the options. Option A: a loss of posterior tibial and dorsalis pedis pulses. The correct answer is option A: a loss of posterior tibial and dorsalis pedis pulses. Correct answer: a loss of posterior tibial and dorsalis pedis pulses. Question 134. The nurse is caring for a client with osteoporosis who is being discharged on alendronate Fosamax. Which statement would indicate a need for further teaching? I should take the medication immediately before bedtime every night. I should remain in an upright position for 30 minutes after taking Fosamax. The medication should be taken by mouth with water. I should not have any food with this medication. Here are the options. Option A: I should take the medication immediately before bedtime every night. Should be taken in the morning before food or other medications are ingested, with water as the only liquid. The correct answer is option A: I should take the medication immediately before bedtime every night. Should be taken in the morning before food or other medications are ingested, with water as the only liquid. Correct answer: I should take the medication immediately before bedtime every night. Should be taken in the morning before food or other medications are ingested, with water as the only liquid. Question 135. The nurse is caring for an older client hospitalized with dehydration. Which site should be used to check for skin turgor? Hand, arm, abdomen, forehead. Here are the options. Option A: forehead, forehead, or chest. The correct answer is option A: forehead, forehead, or chest. Correct answer: forehead, forehead, or chest. Question 136. In order to reduce the risk of hypotension and red man syndrome, infusions of vancus and vancomycin should be administered within 15 minutes only after giving Benadryl diphenhydramine over 1 hour with Zantac ranitidine or other histamine. Here are the options. Option over 1 hour. The correct answer is option A: over 1 hour. Correct answer: over 1 hour. Question 137. The nurse is caring for a client with epilepsy who is to receive phenytoin sodium dilantin 100 mg Roman 4 push. The client has a Roman 4 of D51-2 and is infusing at 100 ml/hr. When administering the dilantin, which is the appropriate initial nursing action? Obtain an ambu bag and put it at bedside. Insert a 16G Roman 4 catheter. Flush the Roman 4 line with normal saline. Remedicate with promethazine phenergan Roman 4 push. Here are the options. Option A: flush the Roman 4 line with normal saline. Because dilantin crystallizes in the tubing if D5W is present. The correct answer is option A: flush the Roman 4 line with normal saline. Because dilantin crystallizes in the tubing if D5W is present. Correct answer: flush the Roman 4 line with normal saline. Because dilantin crystallizes in the tubing if D5W is present. Question 138. A client is admitted with a 2-day history of nausea and vomiting. Which Roman IV fluid is appropriate for the client with moderate dehydration? Lactated ringers dextrose 1% in water 3% normal saline dextrose 5% slushiphore 5% normal saline. Here are the options. Option A. Lactated ringers. The correct answer is option A. Lactated ringers. Correct answer, lactated ringers. Question 139. A client with prostate cancer is being treated with iridium seed implants. The nurse's discharge teaching should include telling the client to strain his urine, increase his fluid intake, report urinary frequency, avoid prolonged sitting. Here are the options. Option A. Strain his urine. Iridium seeds can be expelled during urination. Client should be taught to strain his urine and report to PCP. Seeds are expelled. The correct answer is option A. Strain his urine. Iridium seeds can be expelled during urination. Client should be taught to strain his urine and report to PCP. Seeds are expelled. Correct answer. Strain his urine. Iridium seeds can be expelled during urination. Client should be taught to strain his urine and report to PCP. Seeds are expelled. Question 140. A client weighing 150 pounds has received burns over 50% of his body at 1,200 hours. Using the Parkland formula, calculate the expected amount of fluid that the client should receive by 2,000 hours. 3. 4,006, 80,010, 20,013, 600. Here are the options. Option A. 6, 800. The correct answer is option A. 6, 800. Correct answer, 6, 800. Question 141. The nurse is developing a plan of care for a client with a newly created ileostomy. The priority nursing diagnosis for this client is risk for deficient fluid volume related to excessive fluid loss from ostomy, disturbed body image related to presence of ostomy, risk for impaired skin integrity related to irritation from ostomy appliance, deficient knowledge of ostomy care related to unfamiliarity with information resources. Here are the options. Option A. Risk for deficient fluid volume related to excessive fluid loss from ostomy. The correct answer is option A. Risk for deficient fluid volume related to excessive fluid loss from ostomy. Correct answer. Risk for deficient fluid volume related to excessive fluid loss from ostomy. Question 142. Which person is at greatest risk for developing Lyme's disease? Computer programmer, elementary teacher, veterinarian, landscaper. Here are the options. Option A. Landscaper. The correct answer is option A. Landscaper. Correct answer, landscaper. Question 143. A client with increased intracranial pressure is placed on mechanical ventilation with hyperventilation. The nurse knows that the purpose of the hyperventilation is to prevent the development of acute respiratory failure, decrease cerebral blood flow, increase systemic tissue perfusion, prevent cerebral anoxia. Here are the options. Option A. Decrease cerebral blood flow. The correct answer is option A. Decrease cerebral blood flow. Correct answer, decrease cerebral blood flow. Question 144. The first action that the nurse should take if she finds the client has an O2 saturation of 68% is elevate the head of the bed, recheck the O2 saturation in 30 minutes, apply oxygen by mask, assess the heart rate. Here are the options. Option A. Apply oxygen by mask. The correct answer is option A. Apply oxygen by mask. Correct answer. Apply oxygen by mask. Question 145. The nurse has given instructions on pursed lip breathing to a client with COPD. Which statement by the client would indicate effective teaching? I should inhale through my mouth very deeply. I should tighten my abdominal muscles with inhalation. I should contract my abdominal muscles with exhalation. I should make inhalation twice as long as exhalation. Here are the options. Option A. I should contract my abdominal muscles with exhalation. The correct answer is option A. I should contract my abdominal muscles with exhalation. Correct answer. I should contract my abdominal muscles with exhalation. Question 146. Which action by the healthcare worker indicates a need for further teaching? The nursing assistant ambulates the elderly client using a gait belt. The nurse wears goggles while performing a venipuncture. The nurse washes his hands after changing a dressing. The nurse wears gloves to monitor the Roman IV infusion rate. Here are the options. Option A. The nurse wears gloves to monitor the Roman IV infusion rate. The correct answer is option A. The nurse wears gloves to monitor the Roman IV infusion rate. Correct answer. The nurse wears gloves to monitor the Roman IV infusion rate. Question 147. A patient with pulmonary tuberculosis is receiving combination therapy. To increase the effects of the medication, the patient may be given indaropropranolol, dilantin, phenytoin, benimidprobamycid, neorocyclosporine. Here are the options. Option A. Benimidprobamycid. The correct answer is option A. Benimidprobamycid. Correct answer. Benimidprobamycid. Question 148. Which aminophylline level is associated with signs of toxicity? 5 micrograms/ml, 10 micrograms/ml, 20 micrograms/ml, 25 micrograms/ml. Here are the options. Option A. 25 micrograms/ml. Therapeutic range for aminophylline is 10-20 micrograms/ml. The correct answer is option A. 25 micrograms/ml. Therapeutic range for aminophylline is 10-20 micrograms/ml. Correct answer. 25 micrograms/ml. Therapeutic range for aminophylline is 10-20 micrograms/ml. Question 149. The nurse is completing an assessment history of a client with pernicious anemia. Which complaint differentiates pernicious anemia from other types of anemia? Difficulty in breathing after exertion, numbness and tingling in the extremities, a faster than usual heart rate, feelings of lightheadedness. Here are the options. Option A. Numbness and tingling in the extremity is common with pernicious anemia, but not those with other types of anemia. The correct answer is option A. Numbness and tingling in the extremity is common with pernicious anemia, but not those with other types of anemia. Correct answer. Numbness and tingling in the extremity is common with pernicious anemia, but not those with other types of anemia. Question 150. When caring for a client with an anterior cervical discectomy, the nurse should give priority to assessing for postoperative bleeding. The nurse should pay particular attention to drainage on the surgical dressing, complaints of neck pain, bleeding from the mouth, swelling in the posterior neck. Here are the options. Option A. Bleeding from the mouth. The correct answer is option A. Bleeding from the mouth. Correct answer, bleeding from the mouth. Question 151. The nurse is preparing to administer oral potassium chloride to an elderly client. Which action should the nurse take before administering the medication? Perform a fingerstick for morning glucose, assess for signs of hypocalcemia, withhold food for 30 minutes, check the creatinine level. Here are the options. Option A. Check the creatinine level, determine renal function. The correct answer is option A. Check the creatinine level, determine renal function. Correct answer. Check the creatinine level, determine renal function. Question 152. A client with tuberculosis has a prescription for myambutal ethambutol HCl. The nurse should tell the client to notify the doctor immediately if he notices gastric distress, changes in hearing, red discoloration of body fluids, changes in color vision. Here are the options. Option A. Changes in color vision. Adverse reaction to myambutal is changes in visual acuity or color vision. The correct answer is option A. Changes in color vision. Adverse reaction to myambutal is changes in visual acuity or color vision. Correct answer. Changes in color vision. Adverse reaction to myambutal is changes in visual acuity or color vision. Question 153. A client with inflammatory bowel disease IBD requires an ileostomy. The nurse would instruct the client to do which of the following measures as an essential part of caring for the stoma? Perform massage of the stoma 3 times a day. Include high-fiber foods in the diet, especially nuts. Limit fluid intake to prevent loose stools. Cleanse the peristomal skin meticulously. Here are the options. Option A. Cleanse the peristomal skin meticulously. The correct answer is option A. Cleanse the peristomal skin meticulously. Correct answer. Cleanse the peristomal skin meticulously.